Good Monday evening. Face masks have been a way of life for 2 years now, but thanks to a new announcement from Governor Gavin Newsom, changes are coming. Starting tomorrow, masks will no longer be required, but will be strongly recommended for unvaccinated individuals in most indoor settings. 23ABC's Brianna Polk joins us in studio with an update on what this means for our community and what facilities still require you to wear a mask regardless of your vaccine status.
That's right, Brianna. Well, although the mask mandate will end for Californians in most indoor places, masks will still be required for everyone in high transmission areas like public transit, emergency shelters, and healthcare facilities, among others.
We want to make sure that our messaging is not just one of a law, but one that really is one that empowers communities to pay attention to the health risks and health factors that might drive that decision.
In addition to the lift of the indoor mask mandate, California officials also stated that after March 11th, masks will not be required in schools and child care facilities, but will still be strongly recommended. Dr. Galley, Secretary of California Health and Human Services, adds that this decision comes in effect with schools being an essential place, unlike some entities where people have a choice as to where they want to go.
They go to school because that's the school in their neighborhood. That's the school they're assigned to. We recognize the real difference in risk for young people from infection, for severe disease, and we don't dismiss that in any way.
Even though the mask mandate will lift, Kern County still ranks high in community transmission. Galley adds that's why it's important for people to note the difference between masks still being recommended versus being optional.
Something to reinforce that we're not just moving from required to optional, but that there's gradations here, and we expect as California's conditions continue to improve that we could move our strong recommendation down to a recommendation in the near future.
Additionally, with the state level guidance being put forth, Galley says that people should still be aware that local jurisdictions may decide to keep or add regulations. Kern High School District stated that they are taking the same approach and will continue to work closely with local and state health officials to ensure schools remain a safe place for students to thrive.
Anticipation for preparing around a change, if that's what a district decides to do, if that's what a county decides to do, will take a little bit of time, and then we will sort of get through this period and really allow some of those local characteristics, factors drive the decision.
California officials are optimistic that if we cut transmission rates by 25 or even 50% more in the next 11 or so days, that will create an even lower risk of individuals, masked or unmasked, from getting infected in schools. Coming up at 6, we'll provide more information on how California has maintained to have the lowest pediatric hospitalization rate among other states in the country. Live in studio, Brianna Polk, 23ABC News, connecting you.
Thanks, Brianna. In response to the governor's and the state health department's announcement today, local assemblyman Vince Fong released a statement saying, quote, "Why wait? This should have already happened," end quote. And all of these changes regarding masks and other COVID-19 restrictions may be a result of what health officials call herd immunity. So how is herd immunity achieved? We took an in-depth look at information from the CDC and have those details for you tonight. There are two main paths to herd immunity for COVID-19, infection and vaccines. Herd immunity can be reached when enough people in the population have recovered from a disease and have developed protective antibodies against future infection. Experts estimate that in the U.S., 70% of the population, more than 200 million people, would have to recover from COVID-19 to halt the pandemic. Herd immunity can also be reached when enough people have been vaccinated against the disease and have developed protective antibodies against future infection. And taking a look at our COVID-19 vaccination rates, as of February 16th in California, more than 32 million people, or 81% of the state, has received at least one dose of the vaccine. Overall, more than 27 million people, or 70% of Californians' population, are considered fully vaccinated. Additionally, over 13 million people, or 33% of the state, have received a booster dose. Nationwide, over 214 million people, or 64% of the population, are considered fully vaccinated. And now for a look at our local COVID-19 case numbers here in Kern County. The amount of new cases still on the decline. Kern County Public Health reporting 1,078 new infections since Friday. Our current total amount stands at 236,843. 10 more people were reported to have lost their lives to the virus, raising the total number of COVID-19 related deaths to 2,117 since the pandemic began.